Hi, Billy. Hi, Jeff and Dan. I am with Soen. We're excited to connect with everyone. I can see Sophie and Leah and others hopping in. Hi, everybody.
What's going on?
Dr. Dale.
What's up?
Patient coming out of anesthesia.
You know, we were supposed to get dressed up for Halloween.
Bada bing.
Gonna come as a fish.
No.
It looked like somebody had set a chair, but there was nobody in there. It must be boring.
Problems with it.
Was it?
Oh,
Oh, yes.
Jeff, we're just waiting for one more board member. We're trying to determine our ETA.
1-4.
Oh, yeah, okay.
Well, answering the questions. I feel like I knew enough.
Okay, we'll call the meeting to order.
It is 4:09.
Start with roll call.
Is Dr. Dan with us? Director Logston? So Director Perezquio?
Present.
Okay, Director Shore,
Yes.
Director Delara. Present. And Director Logston is with us. Secretary Barraza should be here shortly. Vice President Rodriguez. Here. And President Rogers.
Here. All right, will you please stand and join me? Ready, begin.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, and with liberty and justice for all.
May I have approval of the agenda? Have one item. I have a motion to approve from Director Delara
Second.
and seconded by Director Shore. All in favor, please say aye.
Aye.
Opposed, motion carried. At this time, comments from the audience may be made on items not listed on the agenda that are of public interest and within the subject matter jurisdiction of the district. The board has a policy of limiting speakers to no more than 3 minutes, and the board cannot take action on items not listed on the agenda. Public input may be offered on agenda items when they come up for discussion and/or action. Do we have any public comments?
There are no public comments.
Thank you. Next on the agenda is a strategic planning workshop facilitated by Soen. We start with aligning the district mission, vision, and purpose. I'll turn the meeting over to them.
Do I use the mic? Yes, okay. Can everybody hear me? Okay. So my name is Sophie Blondeau. I think I've met everybody in the room. Leah, who's joining me, we're from Soen. We're absolutely thrilled to be here in person. Is that on? Is that? You need to be a little closer.
A little bit.
Closer. I'm not used to talking to a mic, so I just want to make sure. Thank you. So anyway, it's wonderful to be here in person. We have really enjoyed getting to know the Valley. We landed yesterday and we started promptly by visiting different organizations. Thanks to Megan organizing those conversations to really get to know the Coachella Valley from different perspectives and to get the voice of the community as part of the process as early as possible. So that's how we spent our day yesterday, and it was wonderful. And today we have two objectives with our time together. We want to make the most of the time that we have together. One is that we have asked all of you to do homework, and all of you did a great job of doing the homework. So we're very grateful for you to have taken the time. And the purpose of that was to really have you look at the existing strategic plan, because when you are developing a future strategic plan, you really want to know where you are in the moment. The idea is not to reinvent the wheel and to start from scratch. So we really wanted to get a sense of where does the staff and board sit on the current strategic initiatives and which ones should be a must in terms of carrying it forward into the new strategic plan. Does that make sense, everybody? Please.
Sophie, can you share with us the organizations that you visited yesterday?
Yes, I can. So I actually wrote them down so I wouldn't forget. So we visited with One Future CV. That's how we started with Kim. We visited CVAG. And we visited with the Latino.
CVAG.
Oh,
CVAG, sorry. My mistake. We visited with the Latino Commission for counseling. We visited with Angel View and the Jewish Family Services.
Thank you.
And it was really, we were very grateful for the open conversations. And we really got to know not only their work, but the barriers and the current issues that their clients were facing. So that was really helpful. Does that answer the question? It was very much, a random selection. There was no intent and cherry picking. It was who was available, and just to give us a first opportunity to meet with those partners. So,
And I think there will be some future rounds.
oh, absolutely, absolutely. So, and actually, we made a point of mentioning that to the organizations we met with, to say that in the coming months, once we have the first draft of the strategic plan, that they would be invited to comment and to give their input. So we made sure that they were aware of that as well.
If I
Yes.
may just ask that we had asked at least 10 organizations, and there were some that were just timing wise, they were not able to. meet,
Right,
but
right.
They are interested in meeting the next time.
Yes, definitely. Okay, so we're going to do two things tonight since we have everybody here. One, we're going to share the results of the homework and really go over the must and should haves of the current strategic plan. And, we'll just reflect back to the whole group, because it's also a nice opportunity to have the staff and the board in one room to just reflect back and say, this is what we heard. Does this align with what you're thinking? And most importantly, is there anything that's missing for you that we should consider as we move forward? So it's not to design the strategic plan. This is, again, still part of the discovery process where we gather information that will be the foundation for the work that we do in next month, basically starting next month. The second thing we're going to do is, as we've said from the beginning, one of the key goals and objectives with this new strategic plan is to make sure that the key voices are heard. And we define those as key stakeholders. So what we're going to do is we're going to spend some time as a group mapping the key stakeholders that are involved in this new strategic plan. And we're going to look at internal stakeholders and we're going to look at external stakeholders. We've done this exercise with the staff. We're not going to do it with the school group today. And we're really going to create personas of these stakeholders so we know who is involved, who we should be keeping informed, and who is going to be affected by this work. Any questions about that? Okay. And if at any point there's any questions or anything's not clear, please let me know or let us know. We're happy to have, hopefully a robust conversation and answer any questions since we're here. So I'm going to hand it over to Leah, who's going to take you through the results.
So yes, as Sophie said, you all completed an exercise, so we sent it out to 12 of you, so 7 board members, and then 5 of the staff that are present with us here today. And we had included every single strategy from the current strategic plan. And we had asked you to prioritize. So what was a must-have, what must be included in the next strategic plan, what should be included, what could and what absolutely will not be included. We also had you evaluate, was this strategy effectively advanced over the last 5 years? And did it have a positive impact on the community? So what we'll go through today is we're going to focus on that first column, so the prioritization. And then you'll see in the discovery report some of the results on whether everyone is aligned on the impact it's had on the community. So
Maybe I have to make that bigger.
over here. So I'll give everyone a moment to take this in and I'll read through it. I know it might be a little bit small on the screen, but what we did is we sorted by the number of people that said, okay, these strategies are a must-have. So starting with that first one there, strategy 2.1, this was the one that had the most alignment. So 10 out of 12 of you believe that this is a must-have in the next strategic plan. So that's provide funding to support an increase in the number of primary care and specialty professionals. The next most aligned strategy was 2.3 with 9 out of 12 of you. And that was provide funding to support an evaluation to community organizations providing expanded mobile primary and specialty care services. And then there are also 2 strategies within the first goal that there was high alignment. So we included everything that was over half, so anything above 7. And that's strategy 1.1, develop a healthcare delivery system vision for the Coachella Valley. And 1.5, identify opportunities and implement selected joint ventures, partnerships with community organizations to jointly support funding of selected community health needs. And then finally, there was 1 strategy within the third goal that a majority of you agree should be a must, and that was provide funding to support an increase in the number of behavioral mental health professionals.
Question.
Yes.
If someone voted, let's just use number 8 as an example, does that mean that somebody decided it wasn't a 10?
That means that someone marked it as either a should, a could, or a won't.
Okay, thank you.
And I will say for most of these, and we're happy to share a transparent list so you can see where all of the numbers align, and of course we'll keep it anonymous, but all of these that were must, no one marked them as won'ts. They either fell under a should or a could.
Thank you.
So taking a moment to sit with that, we wanted to see first, how does this resonate? Does this make sense based on your understanding of where everyone believes the strategy should be? Is there anything that feels like it should 100% be a must and isn't included on this list? And that could be from the current strategic plan, that could be something that's not included, but we want to give everyone an opportunity to share their thoughts on this. And then as a reminder, we will also do the should haves. So we just want you to focus right now on the 100% absolute must haves.
So these were the only musts.
Yes, that had majority alignment.
I just want to welcome, just quick centering. We are reviewing the results of the homework that we gave everybody, and we're just starting. I just didn't want you to be completely. Thank you. Does this feel aligned with what you would see, you would expect to see in the next strategic plan? Yeah.
I'm a little bit surprised on the mobile primary and specialty care services because I guess having the word mobile in there, I know it's been very successful, but when I looked at that, I thought I like specialty care services and expanding but the mobile thing, I think it threw me off a little bit. I think I still rated it high, but I didn't think that it needed to be like our top 3, so just for discussion purposes.
Okay. Any other clarifying, comments about like when you actually did the exercise, what went through your mind, or if there was anything you would have added beyond just marking it a must?
So just to clarify, these rankings, these are the number of people.
Yes, correct.
Yes, thank you,
Number of
Donna,
people.
I think there might have been a little confusion that this is, this number 10.
This is the number of votes.
Yeah, and so these are just the ones that rated it like the very top. That's why I'm thinking my number is not on there because I think I rated it a little bit lower, but it still was like the second slot instead of the.
Yeah, so probably a should.
Yeah.
And did that include staff?
Yes, so it's out of 12, 7 board and 5 staff.
What's a healthcare delivery system? What is that?
We'll figure that out.
How do people vote for something they don't know what it is?
Well, we will look to you to tell us and say, where's the. They need our strategic, don't want to.
There was a, my colleague here has an answer. Go ahead.
For me, I did that as in the form of what the Medi-Cal system is gonna change as of now. Cause you know how there's gonna be a lot of changes in the funding and everything, so we don't know what might affect. That's how I took it. I don't know if that's how it was meant.
Well, and if I may, I think it initially, when it was intended for us to do the community health needs assessment. And so when we did that, then we came up with, thank you. Hold on. Okay. I think it was intentionally, or initially intended to complete the community health needs assessment. Correct me if I'm wrong, anyone, but, and then we determined from that, more in line with developing other strategic goals, et cetera. But I think from that community health needs assessment, then we determined, okay, we have these gaps that we need to fill in like specialty care and behavioral health care, et cetera. And then one of the things that we looked at, developing our new strategic planning process and our RFPs was, did we feel that we needed to do another community health needs assessment? And I think we agreed at that point that we did not need to do that because we felt that the landscape was quite a bit similar. Now, to Director Perez-Gill's point, with the latest changes that will be coming down progressively related to Medicaid, Medi-Cal, I think that's going to, change our landscape as well. So I think that's kind of the background with it, and that perspective, unless anybody else has any comments.
My thought when I was completing the survey about what is defining healthcare delivery system, I thought it included everything, whether it's going to the urgent care, whether it's educational resources, whether it's Jewish Family Services, whether it's behavioral health, mental health, everything. The schools, I just thought anything that is going to provide information or resources, I thought that encompassed everything for me.
That's how I read it too. And I looked at it more as, if we really want to do a comprehensive delivery system, is you look at the social determinants of health. And to Director Delara's point, that's how I looked at it, is FQHCs, urgent cares, both of our hospitals, actually 3 of our hospitals, even down to dental care and all that. That's how I saw the concept. It doesn't mean we as a district are going to do all that, but it's how do we help within the strategic plan and complement those activities.
And then prioritize.
Yeah.
Like, that's how I see it as a network, right? You have like patients, the payer, facilities, infrastructure. So how I see it is like us maybe taking the lead on creating that framework, let's say it, that system, being the lead. I think one of the comments that I made in our last meeting is, are we, that healthcare providers of that system, when people think about healthcare, are they thinking about our district? And I can think of, school districts, right? Like when we think school districts, we automatically think of specific school districts, or energy, we think of IID, if that's our provider. So for me, it's building that system and having our constituents think of us, right? If there's a healthcare need, let's tap into the healthcare district. Okay. So that's really helpful, and we'll capture all those comments, because that's, there seems to be some alignment, but there's, it's a broad definition. So that's definitely something that, as an actual recommendation going forward, we would, as a group, fine tune that so that everybody has a common understanding of that.
And even though we don't do it, like Director Rodriguez said, even though we don't do it, we can direct them to where they can get
Even
more
like a
information.
facilitator more than anything.
Mhm.
And then I'd have another comment, is like, that's where I think the strategy 1.1 and 1.5 align with each other.
Mhm.
Because if you have a health delivery system vision, then you're identifying those opportunities with,
Yes.
you know, partners.
Mhm.
Again, I'll keep using the word social determinants of health, like, but how do we as a district facilitate those partnerships, you know, for better care?
Yeah.
Will you be sharing this with us later?
Yes, absolutely. Yeah, we're definitely happy to share the results.
I think just as a reminder, these number 1 and number 4 were internal goals and they were actually assigned to staff. So this goal number 1 was assigned to the CEO and like goal number 4 was assigned to me. So and I don't know if we had gotten that
24.
part of the strategic plan, but it just was internally what
Oh, no, wait.
we were going to be working on as staff to present to the board and then
That's really helpful.
measure it.
Yeah. And that's actually, you know, one of the questions, right, is does the new strategic plan focus only on the external goals? Or does it include both? Or is there a version that's public facing and one that's, you know, internal? But yes, thank you for that. Remember, that's really. Anything that is not a must-have or is not included here that is on top of mind for anyone that would like to share?
I could remember them, but I can't, so I should have printed them out, bring my computer.
How about when going through the exercise, anything that maybe you thought was included in the strategic priorities and then wasn't there? Anything that feels really important and relevant to the Coachella Valley that was not included?
I think it's, for me, because of the fact that we actually worked a lot, you know, we put a lot of time into it and thought into it, that when I was reviewing it, I thought, oh yeah, all of these, they were very familiar. Unfortunately, of course, you know, Director Longston wasn't here when that happened, and Director Rogers, I think you still participate in the meetings though. So, but they all seem very familiar to me. And what I like the fact they were all included, of course, but I really liked being able to say if I thought that we had actually made an impact. I like that column.
Well, and I think that a focus on underserved areas has always been a priority for us. And, you know, I don't see underserved area in there, but I think it's unsaid.
That's true. But I think we did have equity in there. Didn't we have equity in there?
You do a quick search.
I don't remember if we had any language in the strategies and goals.
That's a good point. Then.
Yeah, just in the vision, I believe.
Okay, should we move on to the shoulds? Okay, great. So we are looking at here, similar logic. This is the should, so it's the second level priority. And those numbers again reflect the number of you out of 12 who indicated that this was a should have. So maybe not the highest priority, but still important to consider. So that's strategy 3.3, 3.4, and 3.6. Provide funding support to community-based organizations, providing tele-behavioral mental health services. Provide funding to community-based organizations, enabling an increase in the number and the geographic dispersion of sites, providing behavioral mental health services. Educate community residents on available behavioral mental health resources. And then there was one strategy from goal 2, which was provide funding to support community organizations providing primary and specialty care via telehealth.
So okay. The 3.31, I think we talked about that being something that we really thought was important, but I don't think we've done that considering locations of other health services. I think there was a lot of talk, but we haven't done anything about it.
Something else I'll put out there that Sophie and I noticed is 6.1 and 6.2 are high priority strategies. And they didn't show up on either must
Can
or
you tell
should
us what
list.
they are, because I can't remember.
Yes.
Yes, they're up there. So I think it's really important to actually go
We're
over
doing
those.
6.1 and 2. So that's play, sorry, this is very small. Play a role in raising awareness and addressing the impact of air quality in the Coachella Valley and the health of community residents, and be a catalyst for community organizations to implement solutions. And 6.2 is play a role in raising awareness and addressing the impact of poor water quality in the Coachella Valley on the health of community residents, and be a catalyst for community organizations to implement solutions. And these fall under goal 6, which is be responsive to and supportive of selected community initiatives that enhance the environment in the district.
How did they rate?
I can show you. Give me a moment to put it up.
I forget how I
Well, it's because you referenced them when you were going down, like if they rated high.
So they're listed as a high.
They're missing
Originally,
in
they
the
were
high.
high.
They're high priority for
But
us,
not,
they're
not at this point.
Oh, so they didn't, they're still, they originally they were, but not right now.
We haven't identified them
Which
as
is
high
kind of funny
priority.
because now we're doing our summit.
So I'll walk you through how we analyze this, but essentially we have the columns here, must, should, could. So for each strategy we went through, okay, 8 individuals put a must, 4 put a should, none put could, none put won't, and it equals out to 12 of you. So if we come down to strategy 6, we have, under a majority. So 5 people put 6.1 and 6.2 as must. And then the majority is should as well. So the majority put it as must or should, but not enough that it was over the threshold.
Do we get a chance to kind of lobby in favor of actually increasing?
Of course,
that's why we brought it up, yeah.
This is exactly the opportunity, yes.
Well, no, I know I voted high for this.
Yeah,
That's why I wanted to
exactly
lobby
why we
in
want to bring it
favor.
up, because we can't focus on everything. There's so many strategies. So we want to help guide you with what everyone thinks is a must, and then get your perspective.
Well, I think it's, oh, I'm sorry.
Well, I was just gonna go back to what Director Rodriguez said about the social determinants of health, and also Director Rogers talking about the areas where there's the highest need. And then the fact that we are doing an environmental summit every year, and that we determined that that's something that we are, that is very necessary in our community. So I think I would be very much in favor of increasing that. I know I rated it high because of those reasons.
And we could definitely make a note of that, for sure.
And would you say that's a must-have?
Yes.
I would too. We've already laid the foundation with 2 health
yeah.
summits. And it's like,
I don't know what got prior to
And-
that.
Of course, yeah.
It's also important to remind everybody that these are the goals under the strategies, right?
Strategy
So-
numbers.
Right, the strategy under the goal. So the goal number 6 is still, right, a goal that we're going to carry over. This is just an example of that. I think that's really important, right? So that's how we're going to design the next strategic plan. You have your strategic pillars and then the goals underneath. So clearly, goal 6, be responsive to and supportive selected community initiatives that enhance the environment in the districts, right? Service area is covered with that. And just before we move on, I think it's important to agree that these 3 goals will remain the key pillars in everybody's mind, both staff and board going forward. Is everybody in agreement with that? Yes? Okay.
Everybody in agreement with that?
I'm in agreement with those 3, but I think that there's a missing element also in that, what we talked about the areas of greater underserved, or to be able to put that as our high priority also.
Okay.
I have a question. What if something's left out of those 3? What happens to and it falls off the table? How do we recapture it? Example, housing.
Well, that's the work of, that's the next phase, right? Of designing if that's a pillar that needs to be
Well, that's the
added.
point. If you're gonna make the pillars that focus, it's gonna be hard to add stuff to it. And I just took housing out of the clear blue sky
Right.
as an issue, because it does command a priority, yet this is all about, medical care.
Well, I would argue that goal 6, housing could fit under environment.
Or broaden it to be all social determinants of health.
Okay, so that's
So
a
it goes
catch.
beyond environment, you know,
Okay,
it's
so that's
just
a
all
catch
social.
base, that's a catch base.
Right.
Okay.
It's flexibility to change these to catch what we need them to catch, but we want to ensure that there's alignment, that these are still high priority in the community. These are still issues that need support.
Thank you.
I think Dr. Luxton.
What's that?
Maybe not.
Oh,
I'm sorry,
Grace.
I saw Dr.
Hey, yeah, I popped it up for a second. I was just gonna echo what Arthur said. I think you're right, Arthur. I think we want to be careful not to narrow our focus too much. And if goal 6 is going to be that kind of catch-all for a lot of these other things that a lot of us have talked about wanting to be a part of the strategic plan, then that's fine. The first 2, I agree, goal 2 and goal 3, definitely agree with those. Those are big time needs in the community, but that goal 6 is also going to capture a lot of things. And so I don't know how specific we want to be on the high priority. I don't know if 3 is the right number. 4, I mean, is there, from your experience doing this, is there a right number of high priority things to focus on? Because I also don't want to come back to this in 3 years and be like, hey, it's not a high priority goal, therefore we're not going to do it, which is something we've already encountered. I think with Carol brought up, she had some things that maybe that she would have liked to seen supported, and she brought up to one of the meetings and made very good points on it, but maybe they didn't line up with how our projects were being funded, so we weren't going that route. So I think I like what you said, Arthur, about not being so narrow on our focus, so that 3 or 4 years from now we come back to this and say, hey, we can't prioritize this because it's not our top priority. So I don't know what other people's thoughts are
I'll
that.
pay you after the meeting.
I think
Oh,
it's striking
Jesus.
a balance.
I think
Yeah.
I'm a little bit fearful is exactly what they both finished saying, is that I'm a little bit fearful in that if we only acknowledge 3 or 4, that what about all the other ones? So, and I don't really like the idea of saying number 6 will be the catch-all, because I think that doesn't give staff the clarification or the guidance that they need to be able to really help us in providing us with the information and being able to follow our directives. I think that would be unfair to them to expect them to read into that.
Mhm.
So I think we need to look at increasing a few more goals that we could all agree on, that are specific enough to help us ensure that we have enough, because this is our 10-year plan or whatever it is, and we don't want to just be 5-year plan. Okay, but still, it is something that I think we need to add more to get staff the clarification.
Do you have
And how I see
specific, I'm sorry, do you have specific suggestions?
Well, I can't remember them all.
Oh, okay.
If I may offer, so I think, correct me if I'm wrong, on my interpretation of this exercise is to determine what are the musts and the must-haves or the should-haves that should move forward from our current strategic plan. And so that's then would kind of develop a listing of the strategies that we see going forward. That's not going to be where it stops. That's going to be kind of a starting point of what we see as the higher priorities of what our current plan is to go forward. And then we will be adding to that in like future sessions. So I think we're just looking at today from the current strategic plan, what we collectively feel should move forward. And then if there's things that we don't think should move forward from our current strategic plan, perhaps they drop off, but they may elevate it again at a later time. Housing is a perfect example of that. And quite honestly, with some of the discussion that we've had over the last few months, I really would have thought that the housing goal and strategy
Would have been higher.
would have had a higher elevation of must have or should have. So I'm actually kind of surprised not to see that come out of this exercise.
That's what I would like to be able to see, this whole data, because I don't remember what we did, the whole thing. And how are we gonna just say, okay, those are fine? What you just showed us right now it gave me an opportunity to be reminded of what we saw, last week. But couldn't we have a little bit more reminder or refreshing before we commit to those 3 or 4?
I don't think we're committing to these 3 or 4 though right now.
But
I
what
think
they're
it's just
saying-
a starting point.
Well, it's a starting point, yes, that's what I just don't like the fact that we're
So we
moving on
wanna-
and then
Yeah,
it's-
so I don't want you to get caught up in that if we lose it out of this exercise, that it can't come back again, that it's lost forever. That's not the case. But it does demonstrate to me, surprisingly, that the housing part of it didn't come out of this exercise in either a must or a should continue into our future strategic goals. So, but that doesn't mean that we can't revisit those in our further discussion. Because, I mean, if we bring it up and we can do that, like what you're suggesting, I think what we're going to be into is, well, I really wanted that one, or I really wanted that one, and I should have changed or whatever. And you, Sonia or Sophie and Leah, you may be able to explain that better, but I think that's what we're after, correct?
Yes, definitely. And again, we're happy to share the raw data so you can see. So for example, the social determinants of health, a lot of you said must or should, but it wasn't a majority, right? Where we included it on the list. And again, this is just to spark the initial conversation and give you a starting point. But we've determined through this discussion that clearly is a priority for all of you, and definitely something that we want to continue to consider. So again, this is not meant to be
I look
definitive.
forward to seeing the data. I need to see it
Yeah.
all, not just these things. I need to see it all,
Right.
just understand what everybody else.
Kimberly, you were trying to make a point.
No, it was actually just what Chris mentioned, that I do not see this as like the final. I think it's just what we're gonna move forward, and that's where it does not mean that this is that this is gonna be viable for us. It means that this is just like our starting point. We'll be able to add, and I would really like to see it be, I'm not gonna say very different, but not exactly the same, not just a carryover, but just the starting point. And I'm okay with having these 3 being kind of like our platform, and then we develop from there.
Okay, so I think we're in agreement. Does everybody feel comfortable before we move on? That this is just a foundational exercise, that nothing is going to be omitted and never looked at again. And it was just to give everybody a starting point for the discussion, and we're more than happy to share the full results, especially as we go forward with the planning process.
So a question for me is, so these were the goals that fell under the high priority of the current strategic plan,
Which we
right?
identified like midway.
Yeah, okay.
So here is the entire.
I just need to go back and look at the strategic plan. That's what I need to do. So, okay,
So there's 2 internal goals, 3 high priority, 2
Right.
non-priority.
because I can just see even in the high priority, I think there needs to be some rewording on the goals, to be honest with
For
you,
sure.
to include like social determinants of health or the housing component of it.
So these are the elements that we took to see.
Originally, that's what it was when we did it the
Yeah.
first time around, focusing on social determinants of
Yeah.
health. But it was so all over the place, like there was parts here, parts over there, or whatever, and this seems more like formatted
Yeah.
so that we can start from here. Because the other way it was just like we were all throwing out ideas. and-
Yeah, and that's not a good way
It
to.
fell off the strategic plan.
I didn't mean to get in the weeds on the goal thing.
No, this is where we're gonna go, but it is important to say that it is a process, and the through line that we're gonna create is the first workshop, we talked about vision and mission last week, and we said, okay, that can be refined. Then you go into the strategic pillars, clearly there can be refinement there, and then we go into the actual activities, right? So we also can't confuse strategic pillars with activities.
That's right.
Right, that's also something that we've noticed. There's a little bit of blurriness sometimes about what is a pillar versus a specific activity. Okay. Are we good to move on? Anybody need a break or any other questions that we haven't answered before we move on? Okay, so let's move on to the second exercise, which is to get your perspective on creating a persona. Can we go back one? Yeah. Create a persona for the stakeholder. So before we go anywhere, one more please. So Okay, so right. I just want to make sure that we are all aligned on the definition, because that's what's the most important part. So a stakeholder is any person or entity that is impacting or impacted by the activities of the organizations today and in the future. And we talk about their having impact and being impacted. So it's really important. So what we want to look at together, and we're going to use the Miro board that we introduced last week, is we're going to take notes as we talk, and we're going to go through two groups. The first are internal stakeholders. It's really getting the board's perspective. And then we're going to talk about the external stakeholders. So, and we invite all of you to jump in, and we'll just take notes as everybody jumps in. So the first question we want to know is, how do you define success of this new strategic plan? What does success look like for you for this new plan?
When we meet our objectives and by our data reports.
For me, it would have clear goals.
Clear goals. Great start. Anything else?
I would say what feedback from our grantees that they've had success from our grant making.
Public feedback.
Thank you.
Public feedback. Okay, thank you.
And when I say public feedback, I don't mean Mr. and Mrs. Joe citizen. I mean the newspaper.
Oh.
I mean the vehicles that assess activities that are going on in the community. So, and the best example I can think of is the impact that Alejandro and his Medora has had in impacting the COVID crisis. I mean, it got a lot of press. It reached national press. You know, those are perfect examples of reflections on us in a positive way.
Does that, can that be defined as brand recognition?
Okay. I could.
Okay, Director Lux.
Yes.
Timeline as well.
Sorry, thank you.
Dan, go ahead.
Well,
I'm being patient. Making sure I heard you guys. I think what everybody said so far has been very good. I don't know if I'd call it brand recognition as more as just, I think when you lead by example and you lead by executing, I think that's what we saw with COVID is like, we had a very high execution strategy. We didn't just have a good plan, we executed effectively. And I think we actually do that pretty well as a board. I think we actually execute our current plan fairly well. What I would like to see as a definition of success is one, I think somebody mentioned, like you set the goals and you achieve the goals, right? I think that's one, that's a KPI where you track that. I also think what I would like to hear coming back from the healthcare community here is that one, they know what the board is doing, and two, they feel the direct impact. I mean, I work in the hospital every day, and currently the impacts of the board is not being felt at the hospital across the board here in the Valley. It's our efforts aren't necessarily being felt in the actual healthcare community. Now, there's pockets where we are. The mobile health clinics is a huge spotlight on how we're doing it. But I think getting feedback from the people here delivering care, I think is going to be a really good marker that we're having success. So reports of, hey, we've got the resources we need. We've been able to treat more patients. We have, an abundance of providers coming out here that are seeing patients. Wait times are going down. I mean, if you look at the wait time in the ER across the Valley right now, it's 12 hours plus, maybe more. I mean, that's a direct, that's something we can have a direct impact on by meeting those high priority goals that we had set before. So I think getting feedback directly from the medical community is going to be very, very important.
I would like to add, when we talk about objectives, can we make sure that we start talking about them as like SMART objectives?
Yes.
That would be one. The other would, I would also say that it aligns with our resources. So we add a number to it or to these objectives. Maybe we could do that upfront, which is something that we haven't or we did not do in our last one. I would also, for it to be successful, I think it also has to be communicated with the public. I think it's important that they know what our plan is, and that's how I see a strategic plan is. I see like that's our roadmap ahead. And so it's almost us telling the story ahead of time. It's telling them this is what we're gonna do, and this is how we're gonna do it. And by 6 months in, a year, 2 years, this is where we're at, and we'll be able to look back at it and be like, yeah, like we're meeting our goals. So that would be another, it's that public, well, communication with the public. So yeah.
Perfect. That's wonderful.
I want to go a little higher level too, and that the community's health has gotten better. And we can measure that through our Healthy Places Index. So I mean, that's really how you're going to show success of the overall healthcare
The
system
KPIs.
within the valley.
That's where the KPIs are gonna come in.
Yeah.
And when we talk about like community health, what I would like to see is actually identify those numbers and actually see, right?
Exactly.
Measure.
And then we could focus maybe on those pockets within the Coachella Valley
Exactly,
that
where they're lower.
are,
Yeah.
are needs.
That's exactly what the county's doing right now, integrated thing. So yeah.
I think the way I would define success is if everybody who needs to know about, who's in need of health services or who is, you know, struggling or just in need, that they have awareness of where to go. So I think this is a little bit bigger than a KPI, but I want to, I think I would want to say that I have done my job if everybody in the harder to reach areas have awareness and being able to access healthcare services. So awareness is one, cultural competency is another, and being able to access. the services.
I would also add maybe for it to be adaptable and flexible. Because I guess maybe going back to Dr. Loxton, right? Like we just don't want to adopt a plan and then change it right away. But I think it would be a benefit for the district to have it be flexible, right? Like, yeah, maybe down the road, we realize that this was not the path that we should go, or maybe something that's outside our control changes, and then we would have that flexibility or the ability to come back and rearrange a few things or do maybe like a midway chicken of the strategic plan.
Well, and also it's, you know, a strategic plan is a living and breathing document. So it is to guide you, but it is also to be able to learn from. So also sometimes some things don't work out. I mean, by default, a strategic plan is saying no to some things. Like that is the reality of a strategic plan. And when you do that, you know, sometimes you may have to reassess going down the road and saying, okay, maybe that was not what we wanted. And so we need to add this in. That's totally doable. It is not a static document.
I think that a lot of, for me, ways of defining success is outcomes that have come from things that we've done. The Desert Healthcare District did a needs assessment in the Dream Homes area. We got a part based on the information that was provided by the, right? And our information provided that to Cathedral City so that they can apply for the grant. Also, like the mobile healthcare units, the neo mammogram and pap smear units. We've seen, I mean, he's seen how many people have come, you know, that there's even, they need more spots, right?
Right.
So that also defines like how our success is going. Numbers and everything can show you numbers, but like the stuff in personally there is what shows you how well you've succeeded in your care, how the community responds to you.
So tangible results, right?
How we support our stakeholders.
Okay. You guys are doing great. How does this feel as an exercise? Okay? Let's move on to what is keeping you up at night?
Wow.
And yeah, I mean, personally, so what's keeping you up at night?
When you think about this process.
Us?
Yes, yes, you.
Oh.
Yes, because it goes through all the, stakeholders.
Yeah, I zoomed in, but we're still on the board of directors.
Yeah, we're going across and creating that picture, that full picture of the board.
The uncertainty.
We're getting to know
of
you.
Healthcare,
Hmm?
the uncertainty caused by the federal government.
Yeah.
That we may have missed a priority that we weren't aware about. There's a need in the community that we missed.
I think that right now our highest, like my fear is what's gonna happen with how she said the medical healthcare system, right? If already right now that the new guidelines have not come out or we're not sure on the new guidelines, we're already behind, right? How is it gonna affect when the new guidelines come? Because I feel like a lot of people are gonna be left without healthcare, you know, and a lot of services like food stand, you know, a lot of the social determinant services.
Yeah.
So that's what keeps me at night, because I'm like, okay, what are we gonna do? You know, how are we gonna like try to help out the community, right? Because that's what we're here for, right? That's why we became the board or whatever.
I just received an email from a telehealth company that I've used that the reimbursement for Medicare is not going to cover telehealth visits for certain people on Medicare.
They said you have to see your doctor at least in person once in the year in order for it to cover, but yeah, it's changing.
I think I would fear like investing or working on something that someone else is already doing. And so would it be like a waste of our resources? That would be one. And then I guess it could go the other way as well, missing something that we could be working on.
Yeah, that was my point. Something.
I don't know where this would fall. It might be a previous question, but I think that we need to mention the fact that we still have responsibility for a hospital, and people associate us with the hospital. So for the next 32 years, 31 years, we still have that resource, that we have a responsibility to ensure that it is being maintained to a certain level, that it is that people, they expect us to make sure that it is still a community hospital, that services are being, so I think somehow we need to mention that somewhere.
I would also fear dissolution of our district, because if we don't have a set vision, the county state can actually come after our monies and dissolve us, especially after we no longer own a hospital. Originally, we're hospital districts turned into healthcare districts. And so that would be one. I know there has been efforts by the state to dissolve some of these healthcare districts that no longer own a hospital. So I think that would be some sort of a fear that if we do not do this right, at the end, we can almost be seen as a district without a purpose, and then that would result in our dissolution.
Okay.
I would also add, I'm trying to figure out how to word this. Community expectations. I think especially with the influx of resources that we're gonna see is, I mean, making sense on that, or?
Like meeting community expectations?
Well, really, it's excessive community expectations.
Oh, I see, yes, okay.
That's the fear.
Handling the excessive,
Yeah.
okay. Or managing.
So I think that we might be expected to do something like super impactful, and then they're like, what happened? right?
Take over,
Right.
take over a bankrupt hospital.
Or that they're trying to have that done right now.
I know, exactly.
Or even like, every organization expects to get funding from the healthcare district,
Right.
So.
It's happening already.
Right.
Another fear of mine would be a missed opportunity. And I think we kind of alluded to that before, where we said we could still change it.
Right.
Flexible is that to ensure that we do not miss out on the opportunity. And that's why I want to make sure that we get it all and that we pick up every responsibility. But that's the fear, is that missed opportunity.
And then also, are we setting, I guess if there would be, are we really setting the district up for its survival past the next 30 years? And I'm not just talking about the dissolution, but like financially, like what's gonna happen to the district. So I think within this plan, we should also include, right, ways maybe for like to expand our funding mechanism.
Yeah.
I know that in our current one, we do have, we talk about grants and bringing money in, but what are we gonna do within the next 10 years, 5, 10, 20, 30, to, you know, for us to continue surviving, right?
Almost the need,
Past.
almost the need for an endowment.
And that actually has been part of our discussion in setting this up is 10, 20, 30 years. And also with managing the financial resources that we will be receiving so that the community, the county, et cetera, can see that we're being good stewards of those resources. And we have plans for those, and we have investment plans so that we're able to pull those monies out when we need them to fulfill our strategic goals and objectives. So like if in the process of this, and I'm probably ahead of myself, but if there's the idea that we're going to do real estate types of issues in the future, you know, those are larger dollars that we're going to be talking about. So how do we strategize when those need to be available, and how do we invest for the long term to manage all those resources? So I think that's all part of our fiduciary responsibility as the district in demonstrating to the community that we have a firm handle on what we're doing.
Wonderful. Let's move on. What qualitative, I think we've actually hit on this already. Qualitative and quantitative data do you need to see that this is working? And I think community feedback, you know, measurable impact on the hospital community, using the health needs assessment. So I think we have that. Is there anything else that you'd like to see to show that this is working?
I wanna hear testimonials. I like to see how this is impacting by storytelling. I think when we get reports from a grantee, we wanna see how did this impact you as a person, you know, so.
Yeah.
I think those are
They're actual life, yeah.
Well, and there's public health data for Coachella Valley that you can review. I mean,
right.
Look at our cancer rates and our asthma rates, and do they improve?
And our
based on
RVA data that we're now using for our RFPs.
Well, for everything, all grants, not just our.
And I'll harken back to HPI scores.
Yeah.
Sorry, can you repeat
Health, HPI, Healthy Places Index. Yeah. Sorry, I'm speaking acronyms a lot.
I just want to make sure I write it correctly.
What's it?
It's okay.
And lastly, from a personal perspective, how will this new strategy affect you?
Hey, wait, I got my hand up. Sorry,
Oh,
I'm trying to be
sorry,
patient.
you're not on the screen for some reason. Apologies.
No, you're fine. So I think one of the things too, from the data aspect that we need to consider, you know, there's this palpable, tangible feel that you have when you live in a community about the positivity that's there. And I think it comes back in multiple forms. One is direct reports from people in the community about what's out there, you know, and what the overall sentiment is. And I think obviously we have a very diverse community, you know, spanning from Palm Springs all the way out to Thermal. But I would say just from, you know, what I've experienced since being out here, there's definitely some negativity and overall in how people view life in general, you know, at least from the healthcare side. I think we've mentioned some of the things here that may be causing some of that, but I think our job as a board is to raise that overall sentiment such that, you know, we can't really impact what's going on outside of our district. You know, we need to control, you know, what's within our sphere of influence. And our sphere of influence is really this valley where we all live. And I think really looking at how do you raise the positive energy, the positive, you know, sentiment that's out there across the community, across everybody we interact. And I think you collect that by talking to different community members, the people that live here, seeing the kids at the schools, looking at different metrics. I think Greg mentioned some of them. I think, suicide rates, depression rates, all of these things that, are kind of an overall indicator of what's the positive outlook on life in the community. So I'm not exactly sure all the metrics that go into that, but like housing impacts that, food, access to food, as that, good jobs, good education. There's a whole bunch of this stuff that really gets bottled up. And I think we have an opportunity here to impact at every level with the right strategic plan. We have the right funding. We have the right support from community members and leaders here to really act in that way. So I think that is something we need to somehow capture a metric around and really seek that goal. That makes sense.
Yes, definitely. And I
I don't know if
think
anybody else has that same sentiment about it.
Yeah, no, you're right.
And I think that like other special districts came to mind, right? We have the recreation district, school districts. These, when we talk about stakeholders, we can also rely on other partners and how the whole unit of special districts within the Coachella Valley, how we can raise, right, the quality of health. It doesn't mean that we have to do it all, but we could do it in partnership with them as well. And so I'm not sure how they measure data, but we could tap into the resources.
So with that in mind, I think collective impact is something that we tried to do in the past and we haven't done very well. So I would like us to look at that again and identify some partners that would be able to have a collective impact for the community.
Good one. Wonderful. This is pretty quick, but how will the new strategic plan affect you personally?
It'll make me feel like I'm doing my job.
Okay.
Exactly what came to mind. I mean,
Yeah.
And
I can
then
get
also
that.
be like realistic, it can affect us or benefit us politically as well. Whatever we come up with, our constituents, the voters within our zones can decide, you know what, you did not do a good job. We need
Right.
someone else.
Okay. Okay, anything else?
Anything else?
Yeah, I mean, it gives me a sense of like pride and feeling good that we're concerned about the people we represent and the health and well-being of the community. I mean, that's a very personally gratifying thing for me. So,
Yeah, absolutely. Okay. And if you have any other additional thoughts, you can always send them our way. This is not like, as we say, it's never, we close the door. So let's move to the external stakeholders. And I think it might be helpful to go through the list. So this is just a list that we put together. But it's not a finite list. We can, look at certain things that could be not looked at in this moment or add. But in terms of external stakeholders, we had identified the community residents and the voters as one group, the local and state government, public agencies like the South Coast, healthcare operators and providers like Tenet Healthcare, and grantees and the nonprofit organizations that you fund, community partners that are not grantees but are collaborators, and then as a last bucket, there was academic and educational partners. So let me start by asking, does this list feel complete? Is there something that's missing from your perspective in terms of stakeholders that would be affected by
under the
that?
healthcare operators, I would at least list out FQHCs.
And county.
I was gonna say.
RUHS.
And then, yeah, RUH
Can you enlarge
County.
that a little bit?
I have a question. Is there a chamber of commerce in the valley?
Oh,
Yes.
gosh, yeah.
Yeah.
There's a ton of them.
Greater Coachella Valley.
Oh, yeah, like the
Robert, they should be a stakeholder.
So after the FQHCs would be RUHS medical system, which is the county's medical system. RUHS. Because that incorporates behavioral health, public health, population health, all of our FQs, our hospital.
Great.
So Do we have anything, this goes to Kimberly's point earlier. Other special districts, so probably under public agencies, the top one there would be other special districts.
What are some examples?
So like the mosquito and vector
Water
control, water district,
Parks,
parks, recreation,
it's actually
Valleys,
recreation. not theme parks and-
recreation. I'm thinking also, Valley Sanitary, which they do, what's the word for it? Drenaje? I just lost it in English. Yeah, great.
And our farm workers, our grower organizations that we've worked with in the past.
Would those be within like the business community?
Yeah.
Or
And-
community
and-
partners, some might be
So they would be
community partners.
community partners?
Like our farm workers union.
And do these need to list all of, or are these just examples of, it's not all inclusive?
It's not, okay.
The senior centers, maybe the daycare centers.
Office and aging.
Is there a big bucket that's missing from your perspective?
Yeah. Senior centers.
That's community parks.
That's
I think
like
there's
to be
like-
in-
like the
Police.
bucket thing.
Because I think we could name a whole lot of
We could-
different organizations. We could go on and on in these categories, but
The police.
In cities.
Okay,
That's a
So we're
public,
like
public,
Maybe you can
public-
narrow-
it's a public agency.
public agency.
Law enforcement, not the police.
Okay, so I think I'm getting the sense we're okay with the buckets.
The faith-based community, would that count or not?
Faith-based community.
And then community partners.
community partner.
Let's put their names in there.
Okay, which, is there a category out of these buckets, I think we have 6, that you'd like to start with that is a priority stakeholder in your, from your perspective?
QHCs.
Look, yeah, the whole healthcare sector probably.
The healthcare operators? Okay, so let's start with, from your perspective, how would they define success?
I'm sorry, what was the question?
How would they define success of this new strategic plan?
More money from.
More providers, more access, better access.
Are we reducing
Maybe
the
us listening
hospitals?
to them?
From your perspective, what do you think they would deem as a success for this strategic plan?
For us to incorporate like their priorities or to listen to them, actually.
Okay.
What they have to say. Bringing them on board.
I think to address chronic illnesses or diseases, to be able to have those, addressed in a plan.
And better access in underserved areas.
Okay, see, it's something that we support their mission as well. Right?
What do they fear?
Say it again?
That we
What
don't
do
give
they
them
fear?
any.
What's
don't give them any money.
What's keeping them up at night?
Budgets, changes in government funding.
Okay,
Staff.
Is that staff shortages
Yeah.
or?
Staff, yeah.
Yeah.
Profe-
Nursing strikes.
Staff capacity. In other words, shortages in disciplines that are underserved, that provide services that are incapable of providing services because the wait list is 11 months to get to see an ophthalmologist.
Okay, maybe outside factors out of their control, like hospital closures and neighboring healthcare districts.
Yeah.
How about, I hate saying this, but active shooters, they stay up,
Emergencies.
being able to respond to disasters, but also I know they probably are always worried about somebody getting into their data and being able to stop services and so all this
I would also think maybe another pandemic.
Yeah.
You just took the words out of my mouth. I was gonna say it.
Attacks on our minority population.
I know.
I would put minority populations,
Yeah, plural.
because it's
Yeah.
not just people of color, it's the
Yeah.
LGBT community.
Yeah.
Okay. What data do they need to see? What data do they like to see?
A lot of it is repeated on what we put. A lot of the data that we would. pull,
Exactly,
they
that's what I
pull
thought.
already.
Okay, I was just gonna say, yeah.
I think they probably want to see how much money are we willing to invest
Yeah.
Mm-hmm.
to help them be able to strategize.
Is Dan still on? Because I don't see him and I don't know if he has his hand raised or anything. He's still on.
I'm still on. Yeah, I'm still on.
Good. Dr. Don, did you have a comment?
No, I agree with everything y'all say, and I'll put my hand up if I have a comment.
Okay, yes, it's just somehow your image
We
isn't
don't see you.
coming up, so please feel free to.
Oh, I'll put my,
verbally
can
say.
you see my hand? Yeah, if I need it, I'll put my hand up.
Okay, perfect. Yes,
Excuse me, I think we missed a major stakeholder,
okay,
the churches.
We said
No, it
faith-based.
wasn't.
Is that included?
yes,
Oh,
I
okay.
think so,
I'm
I
sorry.
think so. Okay, and then let's move on to the last category for this one, which is how is the new plan going to affect them, if at all?
Better patient care.
Sorry, what was the question?
How will the new plan affect them?
Help or maybe whatever we're supporting, we decide to within this plan, would maybe alleviate their ER treating times
Okay,
or just, their numbers at the ER where we're primary.
And providing culturally competent care.
You just.
okay,
Also, that they will be able to have more money, so that way they can be able to plan to do other things. If they see that there's a mutual interest that we could collaborate on, then they'll help them be able to do more.
yeah.
But these are also options.
And along that line is, I would say, opportunity for leveraging.
And I think one of the problems we're going to face is that our inability to solve the problems, all the problems that are facing us.
I think the problem is that we're looking at our goal, at at what's gonna happen in the future. And we're already like taking for certain things that are happening, but they're not, right? 'Cause we're still on the limbo, like on the lease thing and everything else. And I'm concerned that maybe based on that, we're not gonna be able to provide the services that we want to provide. I'm kind of concerned that we're gonna end up spending more money than what we have, by letting people know, oh, we want to do this or we want to do that, and then we're bound to that.
Yeah. So being able to leverage our funds.
Well, we don't even know what funds we have right now.
Yeah, finding partners.
Another thing that I fear is that we have some organizations that may not be able to have the resources that they need to be able to, to do what they need to do to connect with our residents. That just setting them up for not being able to help them is that's why I think we're concerned about what are we missing here? Because we want to make sure that the organizations that are more likely to be able to connect residents that usually fall through the cracks are the ones that probably don't have the expertise or the access to resource to be able to, you know, to be able to serve more people.
So supporting vulnerable organizations.
I just don't know how else we can do that, because like we had where they would help them with the audits, right, and all that stuff.
Which doesn't
So I'm
happen very
wondering
often.
what other ways can we support them, you know, so that they can do what they need. It just feels like a lot of responsibility is being put on the Desert Healthcare District, right? And I mean, I know we are here for the community and to help the community out, but we do have to collaborate with other people and share the responsibilities, you know, and create a path that way, because it's not just us.
Absolutely. And we actually heard that in the conversations we had yesterday, that the Desert Health District is a really great collaborator and convener of partners. We heard that a couple of times.
From staff?
Just kidding. No, from the grantees from the organizations we talked to. And I was obviously on Fonte, but yeah. So, okay, let's move on to the next group. What would you like to tackle next? Community, residents and voters, local and state government, public agencies, or community partners?
Or grantees.
Or grantees, sorry, couldn't read that one. We're running out of space.
I know.
I would say community partners.
Okay, everybody good?
And anybody else?
Yeah, that's fine.
We'll do them all, so.
We'll aim to do them all,
Yes.
yes. Okay, so how do community partners define success?
Be able to serve more, better serve their clients.
Able to serve their clients better, yeah.
But community partners are also like the school districts and that.
They're in a
So,
different
yeah,
category.
or that's a different.
Yeah, they're in a different category.
Or actually, yes, we do have the school districts and then we have the academic and education.
Farm workers.
Yeah, so
Senior
are we looking
daycare.
at that one that says grantees and other, or are we doing both?
This one that I'm highlighting, community partner,
Oh.
non-grantees, but collaborate.
Oh, okay.
Didn't we agree to include the security services, police?
Those are public agencies. It's on the top.
Where?
Mhm. Then
It's
the
on the
top
very
with
top.
local governments. See,
Oh, okay, thank you. Wonderful, okay. I'm 11% happier.
Oh, good.
And also, some of these will overlap, like a community partner could also be a government agency, so
Right.
it's meant to be holistic. Because we
Thank you.
can't do, like
Thanks.
Chris said, every individual
Right.
stakeholder.
We're trying to create a persona, you know, a quick snapshot.
Do we have, where would hospitality industry go? Would it be business community? Because we do have a lot of service workers that sometimes do not have access to healthcare. Is hospitality industry or where would that?
Would that fall under the community
could be
residents?
community
Could we put
resident.
it in parentheses or something
Sure,
so
yeah.
that we know that we are signaling them out, just like farm workers were mentioned somewhere, service workers are.
Okay. Any other descriptors for community partners and how they define success?
Collaboration.
Collaboration, okay.
That's a good one.
I think also like the school districts will have changes in their attendance or things like that, you know, based on a lot of their attendance issues are because of the social determinants of health and
Yeah.
because of the children getting sick a lot.
Mhm.
So I think if they have adequate health care where they can actually get seen, the attendances would reduce, or the attendance would increase.
That first one, that first square, I think that was intended for that category, but yeah. Like that we were talking about our grantees.
Anything else in terms of how they define success?
Funding?
Mhm.
Shared funding, or what's the word I want? Partnership and
Leverage funding.
leverage funding, partnership and funding.
I would say it kind of goes off that comment about increased attendance in schools, but increased engagement in their programs and activities.
Yeah.
Share
expertise.
But also an increase in HPI. That's what they want to see.
Look at it. So many of these can be on all of these.
Mhm. Yeah, we can do that.
We can copy them over.
Yeah, we can do a rapid fire for sure. Okay, what do they fear in terms?
All of the above.
All of the above.
Definitely the government uncertainty.
Yeah.
I think almost everything that was in the other one.
Yeah, yeah. Not the
Retaliation and all that in schools. The fear of retaliation.
Oh, yes, okay.
What about our transient population? Our snowbirds, our Canadian colleagues?
You can put that in the
They're all
top.
included in the
Community
Yeah.
residents.
community residents.
So they're not residents.
Well,
Well, technically
think
they
we
are.
should put in there, homeless, over.
Homeless.
Yeah, okay, there you go,
Homeless.
thank you.
Yeah,
Yeah, that's, well, transient and stuff.
Canadians and homeless. They're the same.
Okay. If we go back to how can we look at the impact of the strategic plan and see if we can copy and paste from the other one? Yeah, perfect. So they would obviously give better care to their community.
Probably should say better like client care.
Client care, right?
More access to services. Different types of services. than normal.
Anything else?
I think that they will probably feel that they are being heard, they are being considered, that they are, so if it's, I would say that, but yeah.
Maybe a little bit of a sense of stability or support, you know, in this moment that everything feels. Okay. All right. Which group should we tackle next? Or anybody need a break? Sorry, I don't want to keep everybody going and going until somebody needs a break. Everybody okay?
Official one or just people get up and step out?
Okay.
Yeah, that's what I'm gonna do.
Okay, feel free. Okay, should we we could do public agencies, the grantees, or the community residents?
Community residents.
Community residents, okay. So from your perspective, how do they define success? I think we have a lot of the.
Receiving care that they normally wouldn't receive
Okay.
based on either their money or their job or their time.
Mhm.
Better access to care.
Better access to care, okay.
And that could include in their own, it's more culturally competent. They receive it in a culturally competent.
Yeah.
What about awareness of services?
Mhm.
About higher quality of life and social determinants of health.
Or just knowing where to go to get help when I need specific help?
Mhm.
Yeah, I like the higher quality.
I think that one is more like knowing. You put knowing where to get help when needed.
Yeah.
maybe knowing where to get help for certain things. You know, like
Special
what is
care.
an emergency, what is considered urgent care, what is considered physicians, right? Because I think that's the problem that sometimes based on the accessibility of where to go, everybody goes to the hospital.
Right.
Right, or to the urgent care, sometimes the urgent cares aren't open, so they go to the hospital. I think a lot of people don't know what things they can go to, like a lower level of care.
Right.
Well, that's, if they could just become more aware of the fact that healthcare doesn't just happen when you have to go to emergency room, but doing the, you know, the eating well, the going to your annual checkups.
Preventative.
The preventative care, you know, the safety things. So it's just better understanding the impacts of you know, of their choices. So giving them better choices of where they live, you know, and things like that, they aware of.
What do they fear? What's keeping them up at night?
Uncertainty of where to get help. They don't know, them not knowing where to go.
Right, not knowing where to go.
Or not having food, or not having, you know,
Being able to afford
money,
care,
yeah.
being able to afford, being able to go to the doctor, not having to choose between paying the rent and going to the doctor. I'm being reported to ICE.
ICE, right.
With the political career.
Political uncertainty. Oh, we've got, yeah, political climate, that's fine.
Yeah.
And how is this new strategic plan going to affect them?
One other thing is that if they take a day off to be sick, that they're gonna get fired.
Lose employment?
Yeah.
Language barriers?
This is for populations and all the populations. We identified, of course, farm workers, homeless, service industry.
Okay.
What about social and legal services?
They fear.
Access to social and legal service agencies.
That's part of defining success.
Yeah,
Yeah.
yeah.
Jay will be the.
Yeah.
Yes,
If you don't know what you don't know, you're in trouble.
right.
Sometimes even if you know what you know, you're in trouble.
You're really in trouble. That too is true.
Is there anything you want to add to how this plan is going to affect them?
Hopefully it'll make it easier for them to be able to access what they need, you know, because it's not just healthcare, it's, you know, food, housing, it's a lot of different
And
things.
also non-traditional delivery of service.
Should we include something about equity?
Successful rehab services that they, have you covered that? Successful access to rehab. We're talking about addiction and
I do like that feeling of equity.
Right, so that everybody feels like they are included.
Maybe looking at it through an equity lens, because there'll be different things for different populations, for different areas, right? It's not all just the same, right? Certain people have certain needs, other people have different needs. So it would be Like just looking at that specific community, okay, what is it that they're needing?
It also affects them because we do receive money from them, so it's their tax dollars that we're like handling, talking about.
But like certain parts of Cathedral City could not be dealing with food insecurity, right? And certain could, and it's the same thing in Coachella. Certain people could be dealing with food insecurity and certain people could not. So it's not just based on geographic, right? There's a lot of different populations in different cities that do face, you know, the same disparities as other regions.
Okay. We have local and state government left, public agencies, grantees, and the academic and educational partners.
Should do public agencies so we can work our way down.
Just, can you all hear me?
Yes, Angelica.
Hi, everybody. I've been listening to our conversation and thinking about the social determinants of health. We love having discussions around that. Going back to, I can't really see faces or name tags, but the comment about understanding the different needs based on population and how there are multiple populations in different regions. Part of what we'll have to do as it relates to measurement of impact and measurement around strategy and approach is finding some of the commonalities of those different populations, because that'll help us create a path forward to really be impactful with the strategic plan. So I just want us to make a note about that when it comes to the measurement piece. What are some of the commonalities and the major differences that we can highlight? That way we can know how do we measure the impact of the strategic plan as it relates to the social determinants of health.
Thank you, Angelica. We'll make a note of that.
Perfect. Thank you.
Just a suggestion to combine local and state government with public agencies and all that.
Okay.
Because it's really all government as a whole. Because even the JPAs are technically a government entity and all that sort of the special districts. So
Fair enough. And everybody in agreement?
Yeah.
Okay, so let's do that.
I'm gonna think, what are they gonna like, right?
Perfect. Okay, so.
Or what do they see success as? Right?
Yes. Yes, sorry.
I would say collaboration again.
Okay.
Better health outcomes.
Increased use of services.
We'd use leveraging resources again in this one.
That's crime rate and.
Does infrastructure play a role here at all?
Oh, yeah. Well, yeah, water.
Water.
Water and sewer. Well, now electricity too.
And the fires we normally have in the.
Okay. What do they fear? What's on their mind? What's keeping them up at night?
Definitely federal uncertainty. resource challenges, budgets.
I think for most of the government agencies, it's like the limitations of what they can do and they can't do, right? And based on money too, like if they don't have the money for certain things that they have to do, they can't do them, so they go out of the way, so. I think that's also something that keeps them up at night.
And how is this new strategic plan going to affect them, impact them?
Better service provisions.
Okay.
Hopefully we can make more productive collaborations. Things affecting the community.
I was gonna say it affects, we have constituents in common, are like districts, areas overlap.
It also reduces their cost if you have a healthier community.
Responsive to resident needs.
What about grantee services? In other words, right now we provide audit support. We provide, I think Donna provides, how do you fill out a grant application, services. And that leads to a whole open channel of maybe even M&A between grantees to, take weak sisters and marry them up to strong sisters and create a new synergy with a new type of an organization. But it would be a series of services that we, the district, would provide as a standalone set of services to all of our grantees.
So perhaps like it's also breaking down silos.
Yeah, that's another way of saying it. Yeah.
Okay. Wonderful. Any other impact?
To make them look
Successful
bad because
impact.
we're gonna have a really, really good strategic plan. They might not.
Okay, we're making good progress.
We have two left.
Two left.
Grantees and nonprofits and academic and educational partners.
Any preference?
Grantees and nonprofits.
Okay.
I feel like if I'm doing the Jeopardy.
I know, 200, which one do you want?
I hope I'm not making you all dizzy with moving around so much.
How is this tool working out for you? Okay, all right. So we can learn and know if we can repeat it or if we don't want to use it again. Okay.
So we already have being able to better serve their clients.
What was the category?
Grantees and nonprofits, so organizations receiving funding from the Desert Healthcare District.
So what's the question about?
Oh, sorry.
What is their success?
Yes.
What is their definition of success?
How do they define success?
Increased allocation to money.
One thing we heard yesterday was the ability to plan for the future, because right now they're so focused on the present crisis that they can't even look up, so.
Maybe like clarity or having it be something clear where they can actually just go to this document and get all the information they need.
Okay.
instead of- Yeah.
Clarity, okay, yeah.
If they feel like they're part of something, I think that.
Okay.
Be included.
Yeah, feel
Yeah, they feel
included.
included. Yeah.
I think we have a lot of what's keeping them up at night and what they fear. Is there anything specific to the grantees that you think should be added?
I think the uncertainty of funding, to your point, that's,
Yeah. Maybe which programs to keep going or which programs that we'll be able to keep going with.
Climate change, we haven't put climate change. I think that worries a lot of organizations because of increased energy costs
Mhm.
and just the clients that it's harder to serve. I know it's a big one, but
Well, in
just
economic,
coming out of summer is just really close to my.
and economic changes.
Mhm. Immigration policy, I'm assuming is also on everybody's mind.
Mhm.
Okay, wonderful.
Is there any data they need to see from the district that we haven't thought about?
I don't think anything outside of the data sets we've listed.
I think the most important thing being is just shared data, whatever it is, whether it's HPI or RBA or whatever, that it is very transparent, that it is very much, that they understand it and how they are part of it.
Right.
Last one is, how will the new 5-year strategy affect them?
More certainty.
Yeah.
Possibly new programming.
Sorry?
New program.
New program. And even outside of new programming, there's expanded programming,
Mhm.
expansion of current programming.
I think it will help them in that they view the district as a partner so that they can explore ideas and being able to collaborate on some things that they see that there's mutual interest or mutual.
Mhm. Okay. Last one, the academic and educational partners. What is their definition of success?
It includes funding to support their goals.
I see Dan has his
Yeah.
hand raised.
I'm gonna use
Scholarships.
I'll use collaboration again.
One of the things here is, and we were talking about some of it in the coming month about, really to deliver healthcare out here, we have to begin training and developing physicians, nurses, respiratory therapists, all of that. And, as I'm listening to all of this, I'm just thinking about, there's two different types of health districts, one that really deliver actual healthcare. And there's the ones that kind of support other people around healthcare. And we do a little bit of both now with our mobile clinics and then our grantee process. We help deliver some care that way. We deliver food, we do some other things. And so I think one of the questions that keeps popping up in my head is like, are we going to be a district that actually is going to focus delivering like care to them? Or are we going to focus on, kind of delivering all the things around health? Because we can do both, but if you're going to focus on delivering healthcare, which is where this question comes in, is you've got to be directly involved with training new physicians and new staff out here, attracting them out here, keeping them here. Because if you don't have that, you cannot deliver actual care. And so that's probably one of the biggest things we face in terms of challenges out here is attracting and keeping very good physician talent. You can hire locums, you can hire people that are transitional people, but those aren't the people you want to build a health community around. There are people that are meant to fill in a temporary need, but they're not somebody you can build around. And so this part is extremely important to me because this is how you build an actual health community that delivers very good quality care.
Yeah, Dan, let me just interject here. The Desert Healthcare District does not deliver healthcare. The mobile clinic is really, we're supporting an organization that's delivering the healthcare. And this is a basic, I mean, you raise a really good question as far as what's the future and what this board would like to do. But traditionally, over the last 30 some odd years, the district has basically not been in the business of delivering or healthcare. It simply supports organizations in the community that provide that, and the mobile unit is actually even an example of that.
Correct. But it's just a big question that we have because it kind of determines what kind of collaboration we need, what partners we need to go out and seek. Do we have those partners here? Do we need to create this ourselves? We ran out. Go ahead.
I think you're talking about a much larger issue that would involve many more employees, and it's a strategic decision that was made years ago, and it was a different district, obviously, because we're not going to be using, we're not going to have we didn't have the resources in those days, but it was a conscious decision of the board of directors that we wouldn't be in the delivery of healthcare business, but we would be supporting the delivery of healthcare by other community organizations. But, that's for this board to decide.
So,
Yeah, no, it's a critical juncture point in my opinion, because currently you don't have like I'll tell you from the health climate and capability of delivering healthcare, somebody has to step up to do it. And with how reimbursements are going and the cutting to funding, you're only going to see less access to care across the board unless somebody steps up and starts to make some very large strategic decisions on how to impact that. And I think we have that capability.
Going back to this question, if I may, how about better, healthier students and their families? Wasn't that the question? What do we want from them? Okay, so being able to have healthier students and their families. I think that's a measure of their success.
What was the question?
How will these partners measure success? How will they
This is
consider that it's a success?
Yeah. Well,
having.
There aren't any pediatricians out here currently.
Students in healthcare.
No, these are higher education. I think we want to know that the students that are going to these schools, that they have access to healthcare and that they have a healthy student body. And then that their families have access, because if their families are not able to access services, they're going to drop out of school. They're not going to be able to continue their education. So I think that that's one of the things that they would look to us is to be able to be successful is if they have healthier students and their students have and their families have access to.
Would our partnership with One Future go into this box in terms
I think so.
Collaboration with One Future and availability of scholarships?
Financial support for students.
Ken has his hand raised again.
Yeah, and would a measure be more primary care and specialty providers being graduated?
Yeah.
But I think there's two, I'm sorry, did you want to continue?
Dr. Dan,
I was just going to comment that I was taking the viewpoint of, the academic and education of healthcare providers and that community. I appreciate what you said, Letty, about healthy students in general across the board. My comment was, just to clarify, was just directly focused around the education and training of new people to deliver care here. But I think I didn't zoom out and look at the over global view that you commented, which is a very good point. I just wanted to say that.
No, mine was totally separate to yours. I'm sorry if that came across.
No,
it
wasn't.
was trying to summarize what you were saying. It was a totally separate thing. Sorry.
No, you're good. Okay, I just want to make sure that I got real narrow focused, and I think you brought it back to a higher view, which is actually probably a good viewpoint, is to really look at all of the education and academic across the board. So
both of them.
Both of them are noted, and one of them definitely is a strategic discussion to be had as we develop the strategic plan. whether the district is indeed supporting organizations that deliver care or if it's actually delivering care.
Well, and that's when you get over to what do they get out of it? So I agree with Dan, is that one aspect of it is partnering with those educational institutions if we're going to expand the workforce. As well, to your point, Letty, is making sure we have healthy kids and families. So,
And I believe at one time in our history, we did operate a dental van directly.
Well, actually, we didn't. It was, we supported the paid for it, basically, but it was closer to what you're thinking. I mean, an example would be if you started to operate a hospital.
No, thank you.
I'm just saying, that's direct, but you know, that's a little
Way
different.
above my pay grade.
Yeah.
The last one.
You also have, the healthcare providers that are more culturally competent.
Good one.
And could we say knowledgeable and empathetic as well? Because I think competency, it takes a longer time to master, but I think we have to also find those who are knowledgeable and empathetic.
And also that are that have a connection to the community, and we're growing and we want them to stay.
And I just wanted to go back to Jeff for just a minute to clarify. I believe we had employees under the foundation that operated those services, Jeff, with the Smile Factory.
No, they were contract.
There was one other.
We paid them though, right?
There was one other.
Oh, the health card. But anyway, great. But to your point, Jeff, the board made a distinctive decision to not operate services or provide direct services, but funding to support services.
Yes.
Okay, I think we've reached the end.
What?
Yes, bravo to everybody. Well done. That was really excellent. As I said, it is not, the end. If you have any other questions or ideas or thoughts, please let us know and send them through. We're more than happy. In terms of next steps, this is going to feed into our discovery report that we will deliver to you by the first week of November. So this is how this wonderful knowledge and input is going to be used and it's going to be reflected back to you. In terms of the detailed results of the MUSCAP, we'll probably wait to share those with you as we go into the strategic planning process. So it's not just shared in isolation, and you'll see it and we'll go back to it and we will make sure that nothing is left out. And I think that's it from us. So we want to thank you so much for your participation. And if you have any questions before we end, we're happy to answer them or stay after.
Any more comments from the board members?
Thank you. Welcome to the district. Thank you so much. Thank you.
very well facilitated. Thank you.
Thank you.
Thank you.
Thank you.
To be discussed.
You're kidding, Greg will throw something at us.
Thank you, everyone.
Do you have a motion to adjourn?
So move.
Second.
All in favor, say aye. Motion.
But you're probably right.
6 o'clock on the nose.